Good day, everyone. So our topic is all about GERD, meaning gastroesophageal reflux disease. Oh my GERD. So for the subjective part, our patient is CDR, 18 years old male from New York, Cubao, Quezon City, born on March 20, 2000, and single and also a Catholic. So for the chip complaint for the dental, he said that I'm experiencing pain whenever I'm chewing food. For the medical part, I experience heartburn. So for the history of present illness for the dental part, 2 years prior to consult, the patient said that he has experienced sensitivity on his tooth, referring to the tooth forceps, which lasted for a few seconds. It triggered whenever he drinks cold beverage, and the patient also noticed that there is a small cavitation on his tooth. He did not take any medication since it's tolerable and did not seek any dental consultation. 1 year prior to consult, the patient noticed that the cavitation on his tooth got bigger. He said that there was a sharp pain whenever the food gets lodged in his tooth. He graded the pain 7 out of 10, which would last for a few seconds. He did not take any medication to relieve the pain and did not seek any dental consultation. So 7 months prior to consult, said that there was only mild tenderness upon mastication. The pain felt not as painful as before, which he graded 2 out of 10. He said that he had a hard time cleaning the tooth. So during the consultation, the patient said that the tooth was asymptomatic. Pain is only felt when the polyp is aggravated. So for the medical part, the patient had a history of hyperacidity. The attack was in December 2017, and he was given 20 milligrams omeprazole prilosec 4 times a day and 150 milligrams ranitidine every 12 hours as medication, which he took for 3 weeks. The patient is not taking any medication anymore, and he has no allergy to any food, medication, and is not under care of any medical doctor. So for the intestinal system, there is a positive nausea, vomiting, and pain. So for the past history, dental part, the patient was admitted in the University of the East College of Dentistry for his dental consultation for odontectomy. So for the medical part, immunization for flu in 2014, there is negative accident surgery or mumps. So for the personal and social history, he is currently studies STEM, a non-smoker, negative for alcohol beverages, denies any illicit drugs, and he's athletic and likes to play soccer. So the family history, the patient's father was diagnosed with hypertension but no communicable disease. The patient's mother is relatively healthy with no known systemic and communicable disease. The patient is oldest among the 4 siblings, but brother and sisters are relatively healthy with no systemic and communicable disease. So for the review of systems for the dental part, for dental part, for general, no complaints, skin, no complaints, head, no complaints, eyes, no complaints, ears, no complaints, throat, no complaints, neck, no complaints, breast, no complaints, respiratory, no complaints, and cardiovascular, no complaints, gastrointestinal, there is a positive nausea, vomiting, and pain. For urinary, no complaints, genital, no complaints, peripheral vascular, no complaints, muscle, bones, joints, and legs, no complaints, psychiatric, no complaints, neurologic, no complaints, hematologic, no complaints, endocrine, no complaints. And for the medical part, general, no complaints, skin, no complaints, head and eyes, no complaints, ears, throat, no complaints. For the oral cavity, there's a positive dental caries, neck and breast, no complaints, respiratory, cardiovascular, no complaints, urinary and genital, no complaints, peripheral vascular, muscle, joints, and bones and legs, no complaints, psychiatric and neurologic, no complaints, and hematologic and endocrine, no complaints. And for the objective part, for the dental, the patient behaves properly and able to ambulate without any assistance needed. For the medical, the patient is awake, alert, and not cardiorespiratory distress. Also, for the dental part, patient is well dressed for the weather and properly groomed. For the vital signs, the patient's blood pressure is 110/80. For the pulse rate, 72 beats per minute. Respiratory rate, 16 beats per minute. So for the vital signs, blood pressure is 110/80, normal. Pulse rate, 72 beats per minute. Respiratory rate, 16 breaths per minute. Temperature is 36.8 degrees. Weight is 58 kilogram. And the height is 170 centimeters. So we computed his BMI, which is normal. So for the physical examination, for extraoral, there's no abnormalities. For the intraoral, there's no abnormalities. For the neck, no abnormalities. Thorax and lungs, no abnormalities. Cardiovascular, no abnormalities. Extremities and musculoskeletal, no abnormalities. Neurologic, no abnormalities. As for the signs and symptoms for general, there's a chest pain, difficulty in swallowing, dry cough, hoarseness, nausea, vomiting, bad breath, wheezing, or interrupted sleep. So for the patient, there's a chest pain, nausea, vomiting, and bad breath. For the assessment, for the dental part, there's a pulpal diagnosis. It's chronic hyperplastic
For the
pulpitis.
dental plan, the non-pharmacologic is pulp therapy of tooth number 46. And for the pharmacologic, 500 milligram capsule of mefenamic acid every 4 hours for 3. For the medical plan, diagnostic is upper endoscopy, ambulatory esophageal pH testing, and high-resolution esophageal manometer. For the medical plan, the non-pharmacologic is breath testing. And for the pharmacologic, for mild to moderate, cimetidine, ranitidine, famotidine, and nizatidine. For severe, omeprazole, ransoprazole, rabeprazole, pantoprazole, esomeprazole, or dexlansoprazole.